I will use the same way that Michael did yesterday, but I will probably ask 2 questions to each panelist. I'll ask them together, and then you can just give a short response to that. I'll start in the order that panelists are seated. So first to Anita, thank you very much for a very clear presentation. There are 2 questions for you. One is, you mentioned about the low level of reporting in the Western Pacific and Southeast Asia. I know from my own background that people are reluctant to report. They see it as, in inverted commas, shaming their own country when you report a problem. But what can be done to address that? And the second is the issue of traditional medicines. Not all economies register traditional medicines. And traditional medicines are frequently adulterated with sildenafil, with phenylbutazone, and with other NSAIDs. What is WHO's approach on that? Thank you.
Thank you so much for the 2 questions. So in terms of reporting, I think we can start really at the level of the community and engaging communities in risk awareness activities. We did, a few years ago, conduct a whole series of awareness campaigns to understand where people were accessing their medicines and why. Did they have any awareness of this issue of substandard and falsified? And we found that often those people who were most vulnerable were the ones most likely to encounter SF medical products. So, a mother who had to take a day off work to go and get medication for her child. And so it actually starts with everybody in who are users or beneficiaries of the healthcare system understanding that they may be at risk of purchasing SF medicines if they do so in informal markets or through other unregulated parts of the supply chain. So we think that's actually important, is having a public awareness. But at the level of the healthcare professional, it's reporting to regulatory authorities. So that's another point where we need to make sure that healthcare professionals have the appropriate means to be reporting, and that's just simple reporting forms. It's simply just having the lot number and expiry date and the product code, and that's where traceability is going to help us an enormous amount, because you'll be able to very quickly either use a machine readable, so you can scan it, or you can actually interpret human interpretable data elements. So sensitising the healthcare workers. And then at the national level, it is scary to report, and there definitely is a perception that maybe this it's slipped through the regulatory controls, and it's true that regulators have to do more and more with less and less resources. But we want to urge regulators to be aware that we do keep the information confidential. We do work with regulators. We would never issue an alert without regulators' permission. We also work with the genuine manufacturers for the falsified products and for the substandard for that matter. So we do take this work really very seriously. But a bulk of the incidents that come to us, they are confidential in that they're not available to the outside world. There's just certain information that's available, the batch number and the stated manufacturer, because we do want, particularly for falsified products, we do want others to be able to search and see if they have those similar products. So I think at different levels, at the community, at the healthcare professional, and then the national regulators. So it's not a one shot fixes all. It's sort of fairly multi-pronged. But I think there needs to be an awareness of the fact that one report might lead to many countries becoming aware before any of the adverse effects at the level of the patient. And we do want to thank the government of Gambia, who were the first ones to report on their contaminated liquid medicines. Now, you've seen a lot of alerts have come out afterwards and think, oh, goodness. Well, that's because their one report then set off a series of events where people started to look more closely and started to detect they would not have tested over-the-counter syrup medicines. And they went through a lot of struggles. They were in the press a lot of turnover of staff, shall we say, but they have remained strong and remained able to get up and stand up in front of... We were just in the IGDRA conference in India 2 weeks ago, standing up and saying, yes, this happened to us. We wouldn't want it to happen to anyone else. So we have some really great examples being set by countries that suffered very much in these last few years. So that's the answer to the first question. The second question on adulteration primarily of traditional medicines. Well, to me, if it's adulterated, and particularly when it's falsified, it's misrepresenting its identity, and if it is producing an adverse drug reaction or an adverse event, then that's clearly a public health concern. Now, I guess from country to country, the regulation of traditional medicines will differ. So in terms of what would be the response would be different. But for me, the end point is that if it's causing an adverse, is causing harm, that's something that is in the purview of the national authorities. Now, it might be the regulators or it might be another part of the government, depending on where traditional medicines sit. But I think it's definitely something that needs to be addressed. You can't not have something. So if you do have those kind of products, they can definitely be reported to WHO's GSMS. We just say any substandard or falsified medical product. And a medical product we have is a medicine, and if a traditional medicine is in your definition of medicine, then we can look at that. We certainly do have those types of products come through, so they can be reported. And we're always there to assist countries who might need some assistance. And as we say, if it's going across borders, that's our other concern.
Thank you. Thank you very much. Ryan, I'm of a generation that studied language Fortran programming, and that was very strange to me at that time. Now nobody studies Fortran, it's Python and things like that, maybe even further than that. So your presentation has had a lot of language that was not familiar to me, but I took away some points from it. You mentioned about using drones. So in the US, it's already being done that you use drones. I'm not sure whether the rest of the world has got regulations in place in what I know that in Malaysia, you can't just fly a drone anywhere. You need to have certain permission to do that. But when you use things like drones for delivery, does the cost of healthcare delivery go up? So you gave some good examples of being able to deliver blood to the person who needed it in that time. But while it is use of technology that is available, will the cost of healthcare go up? So I'm talking from the point of view of economies that are heavily public sector funded. So the governments are already feeling the strain of an increasingly elderly population. And then this is something else. So could you address that, please?
Fortran. Just a quick anecdote. When I was working at Amazon and we were putting in a pharmacy management system, I was fixing something on the back end in Visual Basic, and one of my younger developers looked at me like, how on earth do you know how to do that? And I was like, oh, I took this in college. So yeah, the technology moves quickly and it has a way of making me feeling older. But I think to answer your question on the impact of drone delivery and costs, I think it's going to be an answer where it depends. And so if we look at where a certain company like Zipline really pioneered most of their fleet and how they're actually delivering healthcare, then they're bringing that in the leapfrog effect we talked about back to some of the Western economies. It would actually be cheaper in many cases to deliver blood product via drone versus the need to implement advanced infrastructure in many of these emerging economies, whether that's roads. And their big point was what we've seen in a lot of these drone providers is you need a lot less infrastructure than you think you do. And so I think there's an opportunity where in some cases they will significantly save on total cost and be able to deliver medical products in a way that wouldn't be seen possible. I think there's other examples as well where in some cases the delay of information or the delay of care will ultimately increase time of hospitalization or increase the severity of a condition, be it if we look at the diagnosis of diabetes or certain types of heart conditions. The ability to get a diagnostic test delivered, received, and processed much faster may more quickly identify an indication that can ultimately, if it's treated sooner, reduce total cost to the healthcare system. And so I think delivery to delivery versus a single courier versus a drone, that cost on its face may be more than a delivery of a traditional vehicle, but the total holistic cost may be much less when we consider the patient, the indication, and the use case. And so I think it's going to be a case-by-case basis that different economies and governments are going to have to come to and realize based on the needs of the patient populations they're representing.
Thank you. Well, one of the things that people talk about nowadays when we hear about AI and AI being able to do this and drones and all that, will there be jobs for the future, current jobs? And there is a fear that people will lose jobs. The delivery driver may lose his job because the drone can. Just to tie up with the drone, yeah.
It's a light question, right? I think the answer is we don't know. I think there's certain professions that, we originally kind of talked about automation coming for the blue-collar jobs. You're going to be able to automate self-driving vehicles. You're going to be able to automate, we were talking about with distribution, automated storage and retrieval vehicles that can take the place of certain employees. And we've seen that through the 70s into the 80s in manufacturing, that you were able to do a lot more with a lot fewer people. And so the total available jobs that were necessary fell. And so there are certain jobs that AI is going to be able to look at, such as an X-ray, to be able to tell the difference between blacks and grays to identify use cases like cancer, that the AI is just going to be able to do far better than a human. But if we look at areas, and we constantly speak to a shortage of clinicians that are available to treat various medical treatments, we need more healthcare workers in global economies. And so I think that there's a need, there's a capacity issue. And so my best answer is I don't know, and I would be guessing if I tried to give a definitive answer. But I think there are going to be certain fields that are much more drastically impacted. Right. And so I think it's where I think we go back to areas where education becomes a lot more important, because some fields may have to pivot. And so I think there are some fields and areas where we will see jobs lost. And the hope is that there's so much of a need in these other areas that we will find a way to take people who are smart and motivated and capable and educated and repurpose them in a way that will help the entire broader community to improve healthcare and improve outcomes for patients around the world.
Thank you. Yeah, at the moment, I think we can confidently say that AI will enhance healthcare delivery, and the others is right, yeah, in the future.
A big area that was a focus at the HIMSS conference this past year was that doctors at this point are spending, in some cases, 15, 20, and 30% of their time, depending on their field, just doing transcription, medical notes, data entry. And so that's an area right now where hospital systems in the United States, as they presented, we're already seeing drastic improvements in being able to free up their time of their physicians and their healthcare providers to spend more time with the patient instead of going through medical records, processing data and notes. And so immediately there's a benefit. And so I think those are areas of real opportunity to improve care in the near term that we're already seeing value in various different economies globally.
Thank you. Dr. Moses Jong, very amazing the things that your company, SK Biopharmaceuticals, has done in such a short time. I have a question about the CMOs, contract manufacturers, that you have in many different countries. And do you manufacture the same product in different manufacturers? And how do you ensure quality if you do across these different CMOs? I think you put that as a challenge in one of your slides.
Yeah, the seamless supply of the medicine is the essential of the pharmaceutical supply chain. We believe that is the critical because of if we fail to supply the medicine, it can impact the patient's death. So we have a very strong obligation about that. So in our our company has two rules. First, enough safety stock. And second thing is, even though sometimes we write off some inventories, the second thing is that we use minimum 2 vendors for each step. For example, raw material, API, drug tablet, or the packaging lines. So it can reduce the risk of the shortage. So that we can supply without any shortage from the last 5 years. That is one of the questions. And the second thing is how we can manage the quality management system. Yeah, that is very simple question but that is very critical question. So in our company has the strong quality management system driven by our quality department. So before we select the new CMO, our QA site audit their site as the CGMP grade. So if they cannot meet the quality management system, we cannot hire them. That is one of the very strong point. And when we visited their site audit, sometimes we are using the audit firm, QA audit firm, which has the former FDA or EMA inspector. That is very easier way we meet the CGMP level. And the other way is the regular audit for their site. We get their annual product quality review, and we open their site visiting and the quality audit. So we monitor how they do the manufacturing right as we requested. So that is our critical point of that.
Thank you. Thank you. Ramesh, there's more philosophical question. Are we winning the war against false and substandard medicines, or are we becoming more aware about it? And what do you think is the biggest challenge in handling this issue?
We are not winning the war. It would be rather naive to think so. But then again, I think the answer will change depending on which country you are asking. If you are asking first world countries, first world regulators, they would have told you that they have won the war, right? And this includes even Singapore as well, where, of course, the integrity of the supply chain is very tight. So it is almost impossible to find counterfeits being sold in your actual platforms. But then again, there are off-patent Cialis, Viagra that are sold in the red light districts as well. So have we then won the war? What would the definition be then for us to consider if we have won the war, right? And across ASEAN itself, every region, every country, we are rather different in terms of the landscape that we are in and the infrastructure. So while some countries are ahead, some are trying to catch up. And so again, coming back, we have not won. It's still some way to go, and I think it's still a long way to go. And one of the big challenges, because while we are trying to overcome this hurdle, that's your second question then. What is the next biggest challenge? Technology. We are now trying to, and we have to understand that the law will always be playing catch up. No law is future-proof, right? It's only when criminal syndicates come out and do something new way of doing it, then the law will be enacted to circumvent that and to manage that. So that is our first challenge. Technology, again, is because very soon, in time to come, you have your e-commerce platform, like even for Korea, Coupang or other big e-commerce platform, will now secure the license to then distribute medication. This will then put the last mile operators at a big disadvantage, because now customers can directly go online, pick and choose what medications they want, get the prescription, and based on that, e-commerce platforms will now be able to supply that. And that would be a big shift in your entire supply chain, and in terms of how you embrace that model, right? And you have the metaverse, and you have the Bitcoin, and you have the currency exchange, and you have banks who are not willing to work with you. So, as I mentioned, one challenge, there are multiple challenges that mushrooms because of this one challenge. So it will always be, a growing problem without taking too much hogging the air. Public-private partnership should continue to build and evolve. That is the only one way where regulators can understand what is actually happening outside, and for everybody operating outside will be a good platform to work with the regulators. And I'll just end it there because, it's a very sad story beyond this.
Thank you. Brett, when we talk about supply chain and distribution, during the pandemic, there was the issue of equity and accessibility came up very clearly. How do you think we can move forward to address this in our distribution network?
Yeah, I think, my experience where, we worked across a number of different markets and, various levels of development. But the objective was always the same. The objective is to make sure that if a patient needs a product, they have accessibility to that product, and that if it's prescribed by a doctor, that they're able to take it. And we have to have the infrastructure in place to be able to ensure, whether that's a capital city or, a provincial town in the mountains of Indonesia or Philippines or Vietnam or Malaysia, people in remote areas have the same right of access as people in the city. And so even the infrastructure needs to be in place. So packaging systems that ensure that temperatures are maintained right to the time that it's delivered to customers and potentially to patients as well. But I had an experience also working, it was quite an eye-opening experience of working with public sector health supply chain people in departments of health, some involved in vaccine deliveries and those sorts of things. It was the first time that I, having spent 30 odd years in private sector, that I saw how public sector health chains, supply chains operate. And I started to appreciate that there are different complexities which exist. But even with those differences of complexity, the very basics of supply chain thinking, infrastructure, systems, processes, people, remains the same. And sometimes, the public sector healthcare practitioners don't necessarily see themselves through a supply chain lens. But actually the impact that they have when it comes to ensuring that in a health centre, in a remote area, that if a vaccination program is planned, that there's sufficient vaccines of the right quality, and that there's a healthcare practitioner that can deliver those vaccines, that's what they deserve. And it was a great opportunity, I have to say, to be able to share my experience in terms of supply chain operations and to help them start to join the dots in terms of how what they do impacts the patients that they have a responsibility to look after. It was a very, very moving experience. But I would say that also that, you know, when we look at, for example, the toolkit that we have been talking about over the last couple of days, it's very similar, almost the same to the quality management system that I talked about, and the standard operating procedures that you need to be able to implement. And it takes a lot of time to be able to put those procedures in place, to be able to train your people, to be able to positively impact the execution in a way that has a meaningful impact for the quality and efficacy of the medicines that are being delivered. But it's a mission that we have. Every single one of us in this room has that as a purpose.
Thank you. Yeah. So we are almost out of time. I just like, Volker is not up here, but do you have anything to say in relation to serialization and aggregation in being able to prevent false and substandard? Would it be able to reduce or prevent?
Definitely yes. I think it's all about visibility at the end of the day. You know, criminals can operate best in the dark, when they're hidden, when they are somewhere. I think, yeah, there are a lot of people up there knows that exactly, right? And the thing is, if you create visibility, and this is only possible if you do the serialization and the aggregation and have everybody in the supply chain, all the stakeholders, being able to have a look at the information and see what's going on and trace back to all that, like really do track and trace, then it's possible. But some of the legislations or some of the laws in place, they don't exactly do this, yeah, right? We had a workshop last week in Europe about the European FMD, and there was a question actually at the end of the workshop, did the EU FMD success, or was it a success? And the answer from several people was, we don't know. And that's something I can understand because of the way the system is set up, but it's a little bit sad because there was a lot of money invested, and I think there are some missing pieces which still have to be completed, like aggregation, like the visibility, and so on. So yeah, probably more money to be invested, but there is a target. There is light at the end of the tunnel. It's possible to do that. Yes.
Thank you. Yeah, I can open the floor to the audience to ask questions. Maybe one question, whoever puts the hand up first.
So maybe less of a question and more of a comment. I just loved the reflection that Brett had on his question. And it's really about the responsibility that we all have in the room to ensure access to safe and efficacious medicines regardless of where the patient is, and the role that the toolkit plays in ensuring that patients have those products. Maybe I do have a question, and that is, does anyone, regardless of who it is on the panel, have ideas on how we can improve collaboration and coordination across the ecosystem? Do you have any innovative ways in which we could, as Korea has the host year, improve collaboration and coordination specifically with the toolkit?
One suggestion I would have is that one country or two countries are identified as being prepared to implement and look at the toolkit and maybe select, one or two specific areas that will really make an impact initially, and that you get those countries to work with the toolkit, implement the toolkit, and then be able to talk about their experience, and hopefully there will be some positive impacts and positive outcomes that they experience. But I think it gives the other markets and the other countries an example of how to go about these things. My most recent experience with with one country in particular, but I think it applies across all markets, is working with regulators who are just, the staff of the regulatory team are just flat out with multiple different projects all the time. And so I think we need to think fairly carefully too how you identify which country you want to do it, and make sure that as a part of the discussion that they're not going to get 50 other work tasks that are put on top of, trying to implement this, because it will fail. So those couple of suggestions.
Wanted to say something, Anita?
Yeah, I think maybe it's also a little bit about what we can do as APEC, and I think that making sure that we kind of have a bit of coordinated planning for next year. I do like the idea of having a few focus countries. I find these workshops are really useful. And I think it's just a matter of, we have a number of different centres of excellence, and I know RX360, you're already out of the gate with planning for 2025, but I think it'd be good to see what the other centres of excellence are going to do, and just make sure that we can, coordinate the topics, make sure that we do perhaps a lot of outreach. I realise that probably from WHO's point of view, we've probably got quite a far reach. So making sure that we can have the timetable and really publicise what we're doing. I think it's also about getting the different kinds of stakeholders in the room. And we do perhaps, as WHO, focus a lot on the national, like the governmental entities. That's our natural interlocutor. But I think making sure that we do cover the different aspects of the supply chain stakeholders will be really important as well. Because I think we need to get a bit more sensitisation of the toolkit. Also need to hear about what doesn't work, what works, and making sure, maybe we have too many tools, maybe we need to bring it down a bit, and how do we do a bit of M&E around the particular tools that are of more benefit than others. So that might be my suggestion.
Okay, thank you very much. With that, please join me in thanking all the panelists for their views and